Good day, everyone, and welcome to our next discussion on fundamentals of nursing. So this is about communication in nursing practice. Effective communication is vital for building relationship and achieving success in all aspects of life. Whether we are exchanging ideas, thoughts, or feelings, it is essential to communicate in a helpful and effective manner. For today, these are our objectives: discuss the elements and forms of the communication process, describe the factors affecting communication process and its barriers, examine the phases of the nurse-client relationship, and be familiar with the different therapeutic and non-therapeutic communication techniques. Communication facilitates the exchange of information and to convey thoughts and feelings. Unfortunately, there are times when communication can be unhelpful and may hinder the transfer of information and feelings. As a nurse, effective communication is even more crucial. It enables you to collect accurate assessment data, initiate interventions, evaluate outcomes, promote health, and prevent legal problems in the future. This can only be achieved if you build a trusting relationship with your clients and their support persons. There are different levels of communication. Intrapersonal communication, also known as self-talk, involves an individual's thoughts, feelings, behavior, and self-esteem. Positive self-talk can mentally prepare someone for challenging tasks or situations, boost confidence, and lead to even more effective problem solving. Let us take a look at the thoughts of a student nurse, Sarah, prior to her clinical rotation. Alright, as you would see, self-talk is really helpful, no, to help you get ready for any challenging task that you can encounter in the future. Okay. Next, we proceed with interpersonal communication. So this involves one-on-one interaction, most often than not, face-to-face. And it is the most common form of communication in nursing, and it is highly essential to the nursing profession. So it helps us to, say for example, obtain the history of your patient. Yeah. Next, we proceed with small group discussion. So this occurs when a small group of people meet to accomplish a goal, which requires an understanding of group dynamics and is usually goal-directed. Small group communication refers to the interaction that takes place among small number of individuals, typically around 3 to 12 people, okay, who come together for a specific purpose or task. Okay. In small group communication, participants engage in an exchange of ideas, information, and opinions to achieve their objectives. So this form commonly occurs in various contexts, like say your groups for your clinical rotation, or your related learning experience, in terms of committees, study groups, support groups, and even small social gatherings. Okay. And lastly, we have a public communication. It involves the interaction with an audience. Okay. So nurses frequently speak to groups about maybe health-related topics, present scholarly work at conferences, and or lead classroom discussions. Public communication occurs in settings such as your speeches, presentations, lectures, or public forum where the speaker addresses a mass audience. So the message is typically delivered to the audience as a whole. However, there are limited opportunities for individual interaction or participation for this level of communication. Okay, now let us proceed with the different elements of communication process or the communication process itself. As you can see, the diagram here is showing the process of communication. We have their dashed arrows indicating intrapersonal or self-communication. It is most common, I believe everybody does that, no? Prior to putting into words what are the things that you would want to communicate, you talk to yourself, what are my goals for this communication? Okay? So the solid lines indicate interpersonal communication. Okay? And its most basic form, usually face-to-face communication, consists of a sender. Okay, so the first one, the sender, and that of the message. Okay? Then you have there the recipient and a reaction or a feedback. Okay? So messages are sent and received in both directions during conversation, since the goal of communication is definitely to elicit or to obtain an answer. So the process during communication is continuous. So after receiving a message, the sender of the response turns into the recipient and vice versa. So presented on the right side are the different elements of the communication process, starting off with referent. When we say referent, these are sometimes sights, sounds, sensations, or perceptions, or maybe ideas that motivates a person to communicate to another. Okay? Maybe something that you saw, you heard, okay? Something that you felt, okay? Something that you feel, okay? Your ideas, okay? Which is causing you to start communicating with another person. Okay? Then you have there the sender. The next one is the sender. Okay? And the receiver. So the person who encodes and delivers the message is the sender, while the person who receives and decodes or analyzes the meaning behind the message is your receiver. In transactional communication, the roles of the sender and receiver most often than not switches back and forth between the nurse and that of the patient. Decoding, we define that as the interpretation of the meaning of the verbal and non-verbal expressions combined with the communication. In transactional communication, the roles of sender and receiver switches back and forth. Okay. The context of communication is the next one, or the message itself. Okay. The way of sending or receiving message through visual expression, auditory, or that of spoken words, which travels through the auditory channels, okay, and tactile senses, okay, is our channels for communication. So the manner that the message is being sent is your channel, okay. The message a receiver receives from the sender, expressing thoughts and feelings, is that of the feedback, okay. Feedback is highly essential in communication as it indicates whether the receiver had understood what the sender implies. Okay. There are different factors between the sender and the receiver that influences the communication process, and that Those are your interpersonal variables. Okay, so this may vary from perceptions, culture, expectations, and experiences, okay, that influences communication between the sender and the receiver. And lastly, the environment, okay, so basically this is the setting, which is also a crucial factor in communication. Okay, a good communication environment should provide physical and emotional comfort and safety, of course, between or both parties, that of the sender and the receiver. Okay, so that is the different elements of the communication process. Next, there are different modes of communication. Let us start off by discussing, of course, the very obvious, okay? Verbal. Verbal communication involves the use of spoken words to convey message, okay? So this includes verbal, face-to-face conversation, phone calls, voicemails, and public speaking. So there are different aspects of verbal communication. Aspects, when we say aspects, these are the things we need to consider when we are trying to communicate with the use of words. And what are those? Let us discuss them. Okay, so aspects of the verbal communication. So we have number one, okay, pace and intonation. Okay, pace refers to speed at which the words are spoken, while intonation refers to the variation in pitch, tone, and stress pattern used during communication. Okay, so these two things can vary depending on the speaker's emotion, okay, intention, and the complexity of the message. Okay, so as a sender, no, for the listener or for the receiver to understand what you are trying to say, so optimal pacing is highly necessary, as it ensures that the message is delivered at a speed that allows the listener to comprehend or to understand, okay? Which may lead to, at times, speaking quickly can be overwhelming to the listeners, while speaking too slow can be or can lead to boredom or disengagement. Okay, so adjusting to the pace of the speech can also emphasize certain points that you would want to stress out during communication. Okay, so the rising and falling of the intonation patterns can also signal question or statement structures, indicating whether a speaker is seeking for information or making a statement. So when a speaker is trying to seek for information, so the intonation is on a question form, okay? And then if you are making a statement, then the intonation can convey a range of emotions, such as maybe enthusiasm, surprise, sarcasm, or maybe uncertainty, okay? So this may indicate certain meaning if used in proper setting, okay? Next, we have simplicity. Simplicity in verbal communication refers to the use of clear, concise, and straightforward language to convey messages effectively, okay? So simple language helps ensure that the message are easily understood by your client, most especially for patients. Try to avoid using complex vocabulary or, like, say, medical jargons, technical terms, okay, that may provide confusions to your patient. Okay, so to cite an example, here. So the nurse describes to the attending physician or the doctor of the patient her assessment on Mr. Juan. Okay, so the nurse mentioned the patient presented with dyspnea and tachypnea along with a bilateral crepitus upon auscultation, indicative of pulmonary edema secondary to congestive heart failure. Okay, so given a chance maybe that the patient or the relative hears or overhear what you had reported to your doctor, so this can lead to different confusions because of the highly technical terms that are used for communicating. But to make it simpler, no, to understand what does it mean, let us maybe define each term so that a lay person can understand what is the meaning behind such words. Like say, for example, you have dyspnea. Dyspnea, in simple manner, refers to having difficulty of breathing. Okay? Then you have there tachypnea. Tachypnea refers to rapid breathing. Okay? Bilateral, meaning both sides. Okay, what is heard on one side can also be heard on the other side. Then you have crepitus. Crepitus refers to a crackling or grating sound. Okay? And then you have auscultation. Okay? So auscultation refers to listening, okay, to the different sounds produced by the body using a stethoscope, an instrument. Okay? And then you say pulmonary edema, pulmonary referring to the lungs, and edema referring to accumulation of fluid. So in simple manner, that's accumulation of fluid into the lung. Okay? And then lastly, you have congestive heart failure. Okay? Congestive heart failure is a condition where the heart is unable to pump the blood effectively. Okay? Because of too much fluid. Okay? So while these terms are uncommon, are common in medical terminology and are used by professionals, they may not be readily understood by the individuals who doesn't have any medical training or experience. Therefore, it is important for healthcare providers like us, including nurses, to effectively communicate with their patients and their families using language that is simple, clear, and is easily understood. Okay. So given the brief discussion on each encircled medical terms, now my question is, how will you describe Mr. Juan's current condition in layman's term to address simplicity in verbal communication? Okay. So I would want you to use our comment section below. Okay, so comment your answer below so that your opinion can be heard. Okay. So how would you describe Mr. Juan's current condition in layman's term? Okay. So we'll discuss that when we have our face-to-face discussion. Next, we proceed with the next, which is clarity and brevity. So clarity ensures that the message is easily understood, while brevity ensures that the delivery is efficient. Okay? So communicators can ensure that their message are easily understood, remembered, and acted upon by their intended audience. Okay? So if we try to ensure that what we are trying to say is clear, short, and simple, okay, we can expect that the client will understand it. Okay, then you have timing and relevance. Timing refers to the appropriate moment or context in which the message is delivered. Okay? So if there is a concern, or if your patient has a concern right at this moment, then definitely you need to respond immediately. Okay? Relevance refers to the degree to which a message is meaningful, applicable and pertinent to the listener's interest, needs, and concern. Okay? So what's the purpose of delivering a message at the right time? Okay? It ensures that it is received when the listener is most receptive. Okay? While relevance ensures that the message is meaningful and applicable to the listener's context. Okay. Next, we have adaptability. Adaptability in verbal communication refers to the ability to adjust one's communication lifestyle or style, approach, and message content to suit the needs, preference, and characteristics of the audience and the communication context. Okay. So, ibig sabihin, as nurses, you need to adjust to the need at the moment. Okay. So, adjust your communication level at that particular moment to respond to the need of your patient. So, how do we do that? Okay. So, Nurse Sarah greets her patient. Good morning, Mr. Juan. I'm here to go over your medication plan for today. Okay, and then Mr. Juan nods. but it seems that Mr. Juan looks too uncertain. Okay? So what should Nurse Sarah do at that moment? Nurse Sarah needs to discuss the medication plan to the patient. Okay. So what should Nurse Sarah do? How can she respond to the needs of Man Juan at that particular moment? Okay. Nurse Sarah enters the patient's room to discuss the medication plan for the day. She noticed that the patient, Mr. Juan, appears apprehensive and struggles to understand English fluently. So if you are Nurse Sarah, okay, what will you do? How will you adjust? So comment your answer below again, okay, and we'll discuss this for the next discussion, on our face-to-face discussion. Okay, so when we say being flexible or adaptive, no, it means you are responsive to the patient's preference. No? The nurse promotes effective communication, and it also empowers the patient to actively participate in his own care. So the nurse should try to offer alternatives. Okay, so if you're Nurse Sarah, how will you discuss the medication plan to the patient who has very limited vocabulary or understanding in the English language? Okay, next. Okay, the next one is credibility. Okay, so when we say credibility, that's having trust, engagement in order to provide effective communication. So you should be a person of responsibility and of credibility. So ensure that when the patient looks at you, ensure that you are a person of authority who can respond to his or her need. Okay, and then lastly, you have humor. Okay, humor means using wit, irony, and amusing elements to entertain, engage, and to connect your listener. Okay, so as much as possible, no, try to make it a point that the listener is attuned to your discussion by injecting humor, or the factor or the aspect humor during your conversation. Okay, but try to make it a point not to overpower the humor to a point of maybe breaking barriers already or boundaries between you and the patient. Okay. Now let us proceed with the next mode of communication. We have a non-verbal communication. Non-verbal communication encompasses body language, facial expression, gesture, eye contact, posture, and tone of voice. It often complements verbal communication and can convey emotions, attitudes, and intentions. Here are the different components that make up non-verbal communication. Okay, let's start with personal appearance. Okay, so personal appearance involves maybe your clothing, the way you are groomed, okay, your makeup choices. Okay, so this all tells something about your personality. Okay, so clothing or the choice of clothes communicates a lot about a person's personality, style, and maybe cultural background. Okay, for example, someone wearing formal business attire suggests professionalism and seriousness, while someone in casual clothing may appear more relaxed and approachable. Okay? Grooming, pertaining to your personal grooming, including how you wear your hair, okay? Cleanliness, okay? And grooming habits reflects self-care and attention to detail. So well-groomed individuals often convey a positive impression of hygiene, confidence, and professionalism. Hence the reason why we are very particular to that. Makeup choices, whether subtle or bold, can convey different messages about one's personality, mood, and even confidence level. Okay, so that's the first area or aspect of nonverbal communication. Next, you have posture and gait. Okay, so when you say posture, okay, That's your manner of sitting or standing. And then when you talk about gait, that's the manner of walking. Okay? So it conveys a person's physical and emotional state, personality, confidence level, and at some cultural background. Okay. So an upright posture, whether you are sitting or standing with an erect spine, communicates confidence and attentiveness and even assertiveness. So it suggests openness and engagement in social interactions. A slouch posture, okay, so sometimes described as slumping or hunching the shoulders may indicate boredom, okay, fatigue, or low self-esteem. It can also convey disinterest or lack of confidence. Okay. Next, you have closed posture. So what's closed posture? Crossing of arms and maybe legs or tucking the body inward can signal defensiveness, discomfort, or resistance to communication. So it may indicate a desire to maintain maybe a personal space, okay, or protect oneself from perceived threats maybe, okay. Then you have an open posture. When you say open posture, syempre, opposite to that of the closed, no? You keep your arms uncrossed, okay, and maintain an open stance, suggesting receptiveness, approachability, and willingness to engage with other people, okay. Maybe communicate. It can foster a sense of trust and rapport in personal or interpersonal interactions. Okay. A confident gait. So when we talk about gait, the manner of walking. So a confident gait or walking with a steady pace, upright posture, and purposeful strides convey confidence, self-assurance, and assertiveness. So it suggests a clear sense of direction and determination. So just by the way you are walking, you're already being judged by with your personality. Okay? Kasi it tells something a lot about the person. Hesitant gait. Okay? Hesitant meaning walking with tentative steps. Okay? You're not sure if you're going to step forward or backward. Irregular pace, meaning at times you walk fast, at times you walk very slow. Okay? Or avoiding eye contact may indicate uncertainty, anxiety, or lack of confidence. So it suggests hesitation or discomfort in social situations. So it tells something about the person itself. A relaxed gait, okay, maybe walking with fluid movements, okay, loose limbs, and a relaxed posture communicate ease, comfort, and emotional stability. It suggests also a calm and composed demeanor. Okay. So, to show the difference, no, and how at times this may be applied to nursing, and at times when we interview or when we communicate with our patient, take a look at example number 1 or photo number 1. So nonverbal communication sometimes conveys meaning more effectively than words. Okay, take a look at photo number 1, the posture of this woman. Okay, the lady with the pink top, okay, indicates that that's the nurse, okay, and the lady in black is the patient. So the posture of this woman indicates openness to communication. An open posture, as mentioned a while ago, yeah, you keep arms uncrossed and maintain an open stance, suggests receptiveness, approachability, and willingness to engage with others. Okay, so it fosters a sense of trust and rapport in interpersonal interactions. Okay, compared to photo letter B. Okay, so the listener's posture, okay, the man, suggests resistance to communication. Why? Because he has a close posture. Okay. Crossing arms or legs and tucking the body inward can signal defensiveness or discomfort or maybe resistance to communication. So maybe the client is thinking, what is this woman telling? Or I don't believe what she's trying to tell me. Okay? So it may indicate a desire to maintain a personal space or protect oneself from perceived threats. Okay. To continue with the different aspects of nonverbal communication, we have number 3, Facial expression. Facial expressions are closely linked to emotions, allowing individuals to express maybe joy, sadness, anger, fear, surprise, disgust, or other feelings. Remember the movie? What's the title of that movie? I forgot the title of the movie. There. So facial expression can be spontaneous and involuntary. Reactions to internal states or deliberate attempts to convey emotions to others. Okay, so a genuine smile, for example, maybe communicates warmth, friendliness, and approachability, while a frown, okay, may indicate disapproval or discomfort. Okay, so eye contact and facial expression work together to signal interest, assertiveness, and engagement in social interactions. So facial expression can influence the behavior of other people. Okay, like say for example, I'm here in front of you talking or discussing, and then I see someone who is frowning or maybe raising their eyebrows while I am talking, no? It may tell me that you do not believe in what I'm trying to say. Okay? That tells a lot about the person. So observing facial expression allows individuals to perceive and interpret the emotions of others. Okay? So empathetic facial expression, as mentioned before, no? When we are trying to communicate with our patient or if we are trying to deal with our patient, no? We minimize showing sympathy, no? And we are highly advising nurses to be empathetic. Okay? So empathetic facial expression, maybe like mirroring someone's smile, may demonstrate emotional attunement and support in personal interaction. So if your client, okay, is trying to tell you something and you are smiling, no, it can mirror their behavior towards you. Okay. Next you have gestures. Gestures or body movements convey specific messages and emotions or intentions maybe. Okay? Gestures can express a wide range of emotions such as joy, anger, excitement, or frustration similar to that of the effect of a facial expression. So for example, clenching fist might signify anger, okay? While throwing hands up in the air could indicate excitement or exasperation. So pointing gestures, okay, for instance, can direct attention to specific objects or location, okay? While nodding can indicate agreement or understanding, okay? So maybe cultural integration of the use of gesturing on the Filipino context, no? Most often than not, when we are being asked for directions, we don't use our hands to point the direction. We use our mouth and signal like this. Do, do. Okay. So these are gestures that are essential aspects of nonverbal communication. Okay. Alright, so we proceed with the next mode of communication. We have electronic communication. So in the advent of the fourth industrial revolution, no, different advancement in technology had brought about changes in the way we are living at the moment, no? And most especially, it had different significant impact on the way healthcare is being practiced, is being exercised, is being enjoyed by every people all over the world. Okay, so electronic means or mode of communication is the exchange of information, messages, or data using electronic devices and communication technologies. Okay, so we have, however, the use of electronic communication can have several advantages, but as well as different disadvantages that we should take into consideration before using this mode of communication. Okay, number one, of course, we have advantages. Efficiency, number one. Electronic communication allows rapid transmission of information and enabling healthcare providers to communicate quickly and efficiently. Okay? So this can facilitate coordination of care, referral system, decision making, to provide immediate response to our patients' needs. Okay? Accessibility. Electronic communication platforms are accessible from a variety of devices, including that of your computer, smartphone, tablets, allowing healthcare providers to communicate remotely, okay, from any location, of course, with internet connectivity. Okay? This can enhance accessibility of health services, particularly for patients in remote or maybe underserved areas, of course. Again, given a chance that there is a very good internet connectivity. Next, you have documentation. Okay? Electronic communication enables documentation of patient-related information, conversation, and care in digital format. Okay? So this can enhance accuracy, completeness, and organization of records, making it easier for health professionals, providers to track patients' progress. And of course, to collaborate effectively. Like say the patient is being referred to another doctor. So that particular doctor can just simply browse over the files of the electronic files of this particular patient. Next, you have collaboration. Facilitating collaboration is one of the advantages of electronic communication. As mentioned a while ago, regardless of geographic location, healthcare providers can consult with specialists even if they are, let's say, out of the country, share diagnostic images or test results, okay, immediately, okay, coordinate care, leading to improved or higher improved patient outcomes. And of course, patient engagement. Okay? It also empowers the patient to communicate with their healthcare provider, okay, access medical information, and participate in their own care. Like say maybe reporting of signs and symptoms. Okay? Patient can use electronic platforms also to schedule appointments, request for prescription refills, okay, receive educational materials, okay, at the comfort of their own fingers. Okay, promoting active engagement and shared decision making. However, okay, they also pose several disadvantages. Okay, number one, of course, is security risks. Okay, platforms like this may be vulnerable to security breaches, hacking, and of course, unauthorized access, which can compromise the confidentiality and privacy of patient information. Okay. Next, you have miscommunication. So, in as much as it facilitates faster communication, can lead to misunderstanding or misinterpretation due to lack of nonverbal clues. Okay? Maybe because when you read something, there's nothing about the tone of the voice, okay? Or the context to which the message is being delivered. Okay? So most often than not, say for example, no, on a personal level, no, text messages may be interpreted as like say, nagagalit ka or nagagalit siya kasi naka all caps. Okay? Ayan. So written messages may be ambiguous or unclear, increasing the risk for miscommunication errors in patient care. Okay? Information overload. Okay? Electronic communication can result in information overload, while with healthcare providers receiving an overwhelming volume of messages, no? This can lead to, or let's say notifications, alert. So this can lead to cognitive overload, distraction, and difficulty prioritizing one info from the other. Okay? So this instance, or at this point of view, can potentially impact patient safety and quality of care. Okay? And of course, technological barriers. Okay? So since they rely on technology, okay, one important thing that you need to consider is the technology infrastructure availability, internet connectivity, digital literacy skills, no? How well versed the staff members of the healthcare system is well versed in using the interface of digital platforms. Okay? So patients who lack access to technology or who have limited digital literacy skills may face challenges in engaging with such platform. And of course, legal and ethical concerns in terms of the use of electronic communication. So this can lead to or problems, considerations related to confidentiality, informed consent, liability, and documentation. Okay, so since there is this particular disadvantage on legal and ethical concerns, okay, so the data privacy law, particularly here in the Philippines, should be, or this particular technology should conform with the data privacy law. Okay, so these are the different barriers, maybe, with the use of electronic communication. Okay. Now, factors affecting communication. So there are different things that we need to consider, no, that may affect, okay, may have significant impact on the manner, maybe, of communicating, on the manner a message is being understood. Okay, so number one, you have development. So developmental stages influence communication abilities and patterns. For example, children may have limited vocabulary and communication skills, while of course adult may have advanced language ability. So it's highly essential to understand the developmental milestones. Okay, what are the things that a person at this particular age can already understand or you're expecting them to understand. Okay, but of course, this is not a one-size-fits-all developmental stage. Okay, because there are different factors also that affects the developmental level of a person. Okay, next you have gender. Gender norms and expectation can shape communication styles and behaviors. Okay, based on research, men and women may exhibit different communication patterns due to, number one, socialization, and of course, cultural patterns or cultural factors. So awareness of gender differences can help navigate communication dynamics and promote effective interactions. Okay, so maybe one example could be women are more emotional, okay, is highly considers the emotion of a person, okay, compared to men who are very straightforward in terms of communicating. So that would be one area of consideration in terms of gender. Next, you have values and perception. So values, these are standards that influences behavior, and perception, okay, the personal view, okay, influence how individuals interpret and respond to communication. So people may perceive messages differently based on their beliefs, attitude, and experiences. Okay? And being able to recognize such factor can foster mutual understanding and, of course, bring about effective communication. Next, you have personal space. Okay? Personal space preferences vary among individuals and cultures. Okay? So influencing comfort levels and communication dynamic. So take into consideration that we have to respect the personal boundaries so as to avoid discomfort or intrusion, okay, of privacy in terms of during interaction. Okay. So what are the things that we need to consider in terms of personal space, or how far is far and how near is near in terms of personal space? Okay. So in terms of proxemics in communication, so that's the study of distances. Okay. Number one, we have intimate. Okay, so personal space here is the distance people refer to in interaction with others. Okay. So communication alters in accordance with the different four distances as shown on the photos we have here. Number one, you have intimate distance. Okay? Intimate distance communication is characterized by body contact, okay? Sensation of body heat and smell, and vocalizations that are low because syempre you're near. Okay? So how do we describe the distance between these two persons or communicating at an intimate distance? Okay? So to a point of very close, okay, as in there is no space at all, to up until 1.5 feet. Okay. Next, you have a personal distance. Personal distance, in here, no, voice tones are moderate and body heat and smell are noticed less. Physical contact such as a handshake or touching a shoulder is possible. So if a person is at a handshake level, that means you are at a personal space or you using personal space or distance between your receiver. So from 1.55 feet from intimate to up until 4 feet distance between the two persons who are conversing. Next, you have social distance. So it is characterized by a clear visual perception of the whole person, so you can see them clearly. Body heat and odor are imperceptible. Eye contact is increased, and vocalizations are loud enough to be overheard by other people. Okay? So communication at a social distance is more formal and is limited to seeing and hearing. Okay, so what's the distance between the two? So that's until from 4 feet to up until 12 feet in between. Then you have, lastly, you have public distance. Public distance requires loud, clear vocalizations with careful enunciation. Okay, so although faces and forms of people are seen at a public distance, the individuality is lost. Why? Because there are a lot of persons to consider at a public distance. Okay? Instead, the perception is of the group of people or the community, but not on the individuality. Okay. So the distance when we talk about public distance is more than 12 feet. Okay. Alright, next we proceed with territoriality. So territorial behavior involves claiming and defending physical or psychological space. So this is my boundary. Okay? Individuals may exhibit territoriality in communication contexts such as maintaining ownership over ideas or territories within group setting. So here, we highly encourage to respect boundaries. Okay? And share space can foster collaborative communication. Okay. Take into consideration, do not cross over the territory of that patient unless you ask for permission to. Roles and relationship shape communication dynamics and power dynamics within interaction. Formal roles, like say for example, the supervisor-subordinate role, okay? And that of like say informal roles like the leader and the follower influence communication pattern and expectation. Okay? So understanding your role in a particular group and their relationship helps to navigate hierarchies, okay, and facilitate effective communication. So if you know that this particular person is of higher authority to you, of course you tend to be very respectful when communicating with them. Okay. Next, the environment or the physical environment greatly affects communication in terms of clarity, comfort, and engagement. So several factors that we need to consider with the environment involves like say noise, lighting, temperature, and spatial layout, okay, the amount of space, influence communication effectiveness. So creating a conducive environment for communication also enhances engagement between the persons who are interacting. Next, congruence. Congruence meaning there's consistency between two manner or mode of communication, like say verbal and non-verbal cues. Okay, So, ibig sabihin, when you are trying to say, when you are trying to express words which conveys that you are happy, the nonverbal cues that I can observe when you are trying to discuss them should also say, or should also tell me that you are happy. Maybe you're smiling, okay, you're laughing, okay. So incongruent messages where verbal and nonverbal cues conflict can lead to confusion or maybe mistrust, okay. So we have to align this particular cues. Okay, so they have to be congruent. Okay, next we have interpersonal attitude. So interpersonal attitude reflects one's disposition and approach towards others in communication. So positive attitudes such as empathy, respect, and openness facilitate constructive communication and relationship building. However, negative attitude like maybe hostility or indifference towards another person can hinder the development of rapport or trust. Another example is elder speak. Okay? So elder speak refers to a communication style characterized by the use of simplified language, baby talk, or patronizing speech when interacting with older adults. Okay? So it often involves speaking to older individuals in a manner perceived as overly familiar, infantilizing, or disrespecting. Okay? It may unintentionally undermine the dignity, autonomy, and confidence of an older adult. Okay, so if you may have heard, no, when we are trying to communicate with elder people, we are trying to say in the nursing school na do not call them by lola, by grandma, by nanny. Okay, so we call them by their surname, Mr. Juan. Okay. So elders speak. So as mentioned, no, a manner where we are talking to an older individual in an overly familiar, infantilizing, or disrespectful manner. Example here, I have your photo. If you look at that, no, it says, "How's my sweet little pumpkin doing today? Do you remember to take your medicine like a good boy?" Okay. So, few examples, no? Using diminutives or baby talk. Say, "How are you feeling?" Instead of saying, "How are you feeling today?" The client or the nurse would ask the client, "How are you feeling, sweetie? Are you ready for your nap?" Okay, so instead maybe, "How are you feeling today? Is there anything that I can assist you with?" Okay. Next you have speaking in a slow or exaggerated manner. Okay, so that's times, no? We are thinking the elder people do not understand if we would speak too fast. Okay, so sometimes you would talk. "Do you need help with your shoes?" Okay. So if you do it like that, you can just simply say, "Can I assist you with putting on your shoes or tying your laces?" Okay. Another example could be simplifying language excessively. Okay. The manner you would talk to a toddler. "Do you want to go potty?" Yeah. Okay. So instead, no, "Would you like to use the restroom?" Okay. Next, we have another example, assuming dependency or helplessness. So sometimes he would say, "Let me do that for you. You can't manage it on your own." Okay, so instead, no, "Would you like some assistance with that task?" Okay, so you ask first before assuming already na hindi niya kayang gawin. Next, you have talking down or disregarding the person's input. Like, "You're too old to understand these things. Let the younger folks handle it." Okay, so instead, no, "I appreciate your input. So let's discuss your concerns further." Okay, so ginagalang natin sila, okay, and we still acknowledge their capacity. And lastly, you have boundaries. Okay, boundaries define limits and expectations in interpersonal interaction. So they promote mutual respect, autonomy, and trust. So make sure to understand your boundaries, no? Kasi it provides and foster a safe and respectful communication environment. Okay, so let us proceed with discussing the helping relationship. So the helping relationship is also known as interpersonal relationship or the therapeutic relationship between a nurse and a patient. So this is a therapeutic alliance that is built on trust, empathy, and collaboration, excuse me, to promote the client's health and well-being. So primarily, the goal of the helping relationship is to help clients manage their problems in living more effectively and efficiently, become better at helping themselves in their everyday lives. Okay, so the key to developing or doing a helping relationship is, of course, we have to develop trust. Okay? By, first and foremost, maybe, no? Developing rapport. Okay? You obtain the trust of your patient. Okay? So this is the first step. And the acceptance between the nurse and the client that they are working together. Okay? And of course, the client should see, no, that you as a nurse has a sincere interest on his or her welfare. Okay? So it is characterized by mutual respect and attentive listening. So what do we mean when we say attentive listening? So how do we observe that? Okay. So we do attentive listening, and this can be remembered using the mnemonic SOLAR. Okay, so how do you do that? Or how do you show that your client or that you are attentively listening to your client's concern? Okay, so number one, syempre you sit in front facing your patient. Okay, so when you're talking to your patient, face the patient. Okay? In an open position, as I had mentioned a while ago, no? Do not cross your arms and your legs. Okay? Straighten your spine. Okay? Lean towards the patient. Okay? So this would show that you are interested on the patient's verbalization or what he's trying to say. Okay? Provide eye contact. So make sure that if your patient is talking to you, look at the eye. Okay? And of course, syempre, relax. Okay? So this way, you can provide an environment that shows that you are sincere in listening to your client's concern. Okay. Now, therapeutic communication, as our main purpose for this discussion, is to promote and establish a constructive relationship between the nurse and that of the client. Okay. So unlike other social relationship where there are no specific purpose or direction, the therapeutic helping relationship is a client or goal-oriented or goal-directed relationship. So nurses does not only have to respond on the content of the client's verbal message, but also to understand, okay, the hidden message that is given or communicated through non-verbal means. Okay. So the content of the client's communication is the words or thoughts distinct from their feelings. No? Sometimes people can convey a thought in words while their emotions contradict the words. Okay, that is why words and feelings are at times incongruent. And as a nurse, you need to verify verbal messages. Okay? Find cues if they are really existing. Okay? So establishing the purpose, these are the purpose of the therapeutic communication. Establish, therapeutic relationship or therapeutic provider-client relationship. Identify the client's concerns and problems. Okay? Assess the client's perception of the problem. Recognize their need and guide the client towards satisfying and achieving the goals. Okay. Now, there are 4 phases of the nurse-client relationship. Okay. So these are the things that we need to understand if we are to start dealing with patients. Okay. So number 1, we have the pre-interaction phase. So under the pre-interaction phase, it begins before the nurse has contact with the client. Meaning, there is no client yet at first. Yes, okay. The nurse's task at the pre-interaction phase, no, is self-exploration about his or her values and feelings for caring for a patient. Okay. Hence, the reason why we had an activity before regarding self-awareness. Okay. So I would need or I would wanted you to explore your feelings, okay, when asked about how would you describe yourself, okay, how are you socially, how do you relate with other people, okay, because this is the most important thing prior for you, no? This is a prerequisite before you start communicating with your patient, okay? Explore yourself first because it is you or yourself whom or which we are trying to use to communicate, to help our client. So that's why it's called the therapeutic use of self. Okay. And then, after, okay, so you review pertinent assessment data and knowledge of your patient. Consider potential areas of concern that could be used or that could be our foundation for the goals or for the setting of our goals so that we can achieve any plan that we can set at that particular moment. Okay? And then you have develop plan for interaction. So that is during the pre-interaction phase. So how would I try to deal with my patient? Okay? What are the things that I know that I can use so that I can deal with my patient? So that's pre-interaction phase. Next, you have the introductory phase. So under the introductory phase, this is already opening the nurse-client relationship. Okay? At this point, we clarify the problem of your client and we structure and formulate the contract. When we say contract, meaning at this moment in time, we are also setting how long would the nurse-client relationship be. Okay? So, ganun pala dapat, ma'am. Sa umpisa pa lang, alam na natin kung kailan matatapos yung ating interaction with our patient. Of course. Why? Because we need to set boundaries on up until when and up until what point should I interact with my client. Okay. So, establish boundaries, acceptance, and trust with the client. Okay? At this point, we also establish expectations of the relationship. What are the things that you would want me to do? What are the things that you would want me to help you with? Okay? And, of course, determine why the client sought your help and whether it was maybe voluntary or involuntary. Why is it necessary to determine this? No? Because this would help you in determining how well should your client be accepting the plan of care that you would provide to them. Okay? Assess the client, no? Define goals, and prepare the client for the termination and separation of the relationship. So at that particular moment, at that particular introductory phase, we are already setting our boundaries. Okay? Next, working phase. So under working phase, we explore and understand thoughts and feelings and facilitate taking action. Facilitating and taking action. So at this point, we need to promote an attitude of acceptance. No? The client accepting the plan of care that both of you had set, okay, had developed, okay. Assess the client's ability to express their own feelings. So there might be instances that the client is not that assertive enough to express their thoughts. Okay? So you need to assess how does your client express themselves. No? Promote insight and use of constructive coping mechanism so that it can also increase your client's independence. Okay. And lastly, of course, is your termination phase. So at the termination phase, we prepare the client for the termination. Okay. So at this point, we discuss what are the things that we found out during the introductory phase. What are your assessment data? Then you discuss to your patient what were your goals at the start of the relationship. Okay? And then what were the different interventions that you had, both of you had decided to set or to use so that you can achieve your goals. And then provide also an evaluation, meaning comparing what we had saw on the assessment data at the first hand of interaction, what are the things now that you can observe and compare how does one differs from the other. Okay, so that you would know if the relationship was successful, you were able to obtain your goals. Okay, so you need to summarize everything. Okay, and then evaluate the progress and achievement. So that's what we mean by that. Okay, the nurse and client accept feelings of anxiety or dependence so that they can go on separately with the relationship. Okay, so why is it necessary that the client knows when, or it is clear to your client that the relationship has already terminated or has already ended. Okay, because at this point in time we should know, okay, and we should let our patient know that they should be responsible now for their care. So the nurse or the patient is no longer dependent on the nurse for the care that he or she needs for continuing his or her health care. So those are the different phases of the nurse-client relationship. Okay, now we proceed with the different therapeutic communication techniques. In nursing practice, therapeutic communication techniques are essential for building trust, promoting healing, and fostering positive relationship between nurse and patients. So here are some of the communication techniques that are therapeutic, or the things that we are advising always to use when dealing with our patient. So we'll be discussing them one by one. Okay, starting with using silence. So using silence means accepting pauses without interjecting any verbal response. Okay, so the use of silence allows the patient to reflect on their thoughts and emotions without any interruption. Okay, so it gives them an opportunity to express themselves at their own pace. Okay, and fully concentrating on, as nurses, we use silence so that we can fully concentrate on what is the patient is trying to say. Okay, understanding the message and responding appropriately after. Okay, so how is it elicited? No, maybe sitting or walking quietly and attentively with the client until they are able to verbalize their thoughts and feelings. Okay. Next, we have providing general leads. These are using statements that encourages verbalization, maybe choosing a topic of conversation, and facilitate continued verbalization. Okay, so at this point, it encourages the patient to express themselves fully and provide detailed responses. Okay, and this way, it can facilitate meaningful dialogue and exploration of thoughts and feelings of the patient. So one example could be, perhaps you would like to talk about, okay. So the client can, so this kind of statement can lead to the client discussing anything that he or she would want to discuss. Okay. Clarifying. Clarifying is seeking additional information or explanation. Okay? This ensures that there is a clear understanding of the patient's concerns and statements. So, as nurses, we use them if at times paraphrasing would be difficult for us, or when the speech or the voice of the patient is maybe garbled. Okay? So to clarify a message, the nurse may restate the basic message or maybe confess a confusion. I do not understand, maybe I do not follow. Okay? And ask a client to repeat or restate the message. Okay. Let's say, for example, I'm not sure I follow or I was able to follow what you're saying. Before you go on, what do you understand? I want to understand what you mean by what area you would want to clarify. Okay. Next, you have validating. Okay. So validating acknowledges the patient's feelings and experiences are legitimate and understandable, promoting a sense of acceptance. Okay. Or at certain times, validating is a method of similar to that of clarifying that verifies the meaning of specific words rather than the overall meaning of a message. Example would be, I'm afraid I cannot go back to work after this surgery. So you would want to know what does it mean, or what you would want to validate what does the client mention about, or what does it mean when the client said cannot go back to work after the surgery. Okay? So tell me if I understood your concern. You are worried that you will not be able to return to your usual way of life. Yeah. So that's validating. Okay. Giving information. It's providing in a simple and direct manner specific factual information. Okay? So when information is not known, of course, the nurse cites this and indicates who has it or when the nurse will obtain it. If, let's say, for example, it's about a tangible object. Okay? One example could be providing information about a procedure. Mr. Juan, Pedro will be having an abdominal ultrasound today, so we can identify what causes his abdominal pain. This is painless, but he needs to drink a lot of water to make his bladder full. So these are the things that you can discuss to your client. Or give information, or what are the things that a patient needs to know about a specific procedure. Okay? The purpose. So identify what causes abdominal pain. Is it painful? Okay? And what are the things that he needs to do in order for him to be prepared? In this case, drink a lot of water so the bladder will be full. Okay. Next, acknowledging. Okay, or acknowledging is giving recognition in a non-judgmental way. Okay, maybe to appreciate a change in behavior or an effort the client has made. Acknowledging can be done by, like, say, I noticed that you are wearing new clothes today. Yeah, that's acknowledging. I noticed that you have a new hairstyle. Okay. Presenting reality, helping the client to differentiate the real from the unreal. Okay? So in case of, like, say, hallucinations, yeah. So that sound came from the cat who usually stays outside your window. So maybe the client was mentioning, there's a ghost outside my window that keeps on, or there's a sound that's coming outside from a window. I'm thinking there's a ghost. Okay? Or the aliens are here to get me. Okay, so to present reality, so saan nagagaling yung sound? Okay? So usually there's a cat who stays outside your window, and that was the sound you heard a while ago. Okay. Focusing. Focusing helps the client expand and develop maybe a topic of importance. Okay? So it is important for the nurse to wait until the client finishes stating main concerns before attempting to focus on another. So the focus may be an idea or a feeling. However, the nurse needs to emphasize a feeling to help the client recognize an emotion disguised behind the words. Okay. Example. We have talked a lot about your medication. Now, let us look more closely at the trouble you are having in taking them on time. Okay, so That's focusing. Next, reflecting. Sorry. Alright, next we have reflecting or directing ideas, feelings, or questions or content back to the client. Okay, for example, everyone here ignores me. Okay, so you want the client to reflect on the word ignore. So you're trying to stress out ignores you. It's more of like asking, how come you were able to say that you are being ignored? Can you cite some instances? Okay, so that's reflecting. Okay, summarizing. It's a review of key aspects of an interaction. Okay, so summarizing. Example. You've told me a lot of things about why you don't like your position at work and how sad you've been. We've also come up with some possible ways to make things better. You've agreed to try some of it, and then let me know if you need any help. Okay, so summarizing, no, entails the restating of key points of the conversation to reinforce understanding. Okay, can also be an avenue to clarify misunderstanding and ensure that both parties are on the same page, or both understood what was communicated. Okay, so those are the different therapeutic communication techniques that we as nurses, you as student nurses, should start doing as of the moment. Okay, so as they say, no, practice makes perfect. Okay, and now we proceed with the different non-therapeutic communication techniques, no? So these are behavioral respondents that hinders effective communication, hinders trust, and contribute to misunderstanding between nurses and patients. And you might be surprised that you are most often than not using these non-therapeutic communication techniques in, like, say, maybe dealing with your friends, okay? And it's not helpful at all. Okay. These are different non-therapeutic communication techniques. So let's start by discussing stereotyping. Okay? Stereotyping is offering generalized and oversimplified beliefs about people. Okay. Example, older people always forget things. Ayan. So, generalize natin na lahat daw ng matanda ay makalimutin. Okay? So, instead, we may say, it is common for memory to change as we age, but everyone's experience is unique. Is there anything specific you are concerned about remembering? Ayan. So, that can be a nicer way or a therapeutic way of discussing things about remembering in terms of older age. Okay? Teenagers are always rebellious and irresponsible. Okay? So instead, we may say adolescence can be a challenging time and it is normal for teens to explore their independence. How can we support you in making responsible choices? So that could be a better way of saying it. Another one could be people with disabilities are helpless and need constant assistance. Okay, so we can rephrase this to be therapeutic. Each person's abilities and needs are unique, and many individuals with disabilities lead independent lives. So how can we adapt our environment to support your autonomy and inclusion? Okay, so as we mentioned, no, we no longer call them people with PWD or people with disabilities. Okay? We now call them differently abled individuals. Okay. Next, we have agreeing and disagreeing. So agreeing outright to what the client had mentioned or disagreeing outright, okay, may cause a client to become defensive. Okay? So it may imply that the client is either right or wrong and that the nurse is in a position to judge this. Okay, so these responses deter clients from thinking through their position and may cause a client to become defensive. Let's say, for example, you should not think of suicide or assisted suicide. This is not right. Hindi tama yan. Assisted suicide is euthanasia. Okay. So instead, no, we can say, I'm surprised you are considering about assisted suicide. Would you like to tell me more about it? Okay. So this way you can explore the feelings of the patient. Why she was able to mention that she's considering this kind of choice. Okay. Next, you have defensive. Attempting to protect a person or healthcare services from any negative comment that you heard from your patient. Okay? So these responses prevent the client from expressing their true concerns kasi right then and there, you're already blocking them. Okay? Example. No one here would intentionally lie to you. Ano naman nagsisinungaling dito? Okay? So the nurse is saying, if the nurse is being defensive, no, it tells the patient na you do not have the right to complain. So that's how it's being interpreted by the patient. Okay. So defensive responses protect the nurse from admitting weaknesses in healthcare services, including also as well personal weaknesses. Okay. So, di ba? As nurses, we have to acknowledge the things that we can and we cannot do. And if people are trying to point out, these are the things that I can see or I can observe about you, maybe it's about time that we assess ourselves. Okay. Next, challenging. Giving a response that makes a client prove their statement. Okay. So this responses indicates that the nurse is failing to consider the client's feelings. Okay. Making the client feel that it's necessary for me to defend my position or my opinion. Okay, let's see, for example, I feel as if I am dying, parang makamatay na ako. And then the nurse will reply, how can you say that when your pulse is 80? Okay, so that's challenging. Okay, next you have probing, asking for information maybe or chiefly out of curiosity. Okay, so these responses are considered prying and violate a client's privacy. Okay, so most often than not, it's called about asking why. Okay. So we never ask why. If a patient says something, do not ask why. Bakit? Okay? Instead, we need to explore our client's feelings. Why the client was able to say such remark. Okay? So asking why kasi is often probing and places the patient again in a defensive position. Okay? Why are you anxious? Ba't ka kinakabahan? Okay? Instead, you may say, you seem upset. Okay? Would you like to talk about it? Okay. Next, you have false reassurance. False reassurance are using cliches or comforting statements of advice as a mean to reassure your client. Example, don't worry, everything will be alright. Okay? Instead, you need to acknowledge the patient's concern and provide empathetic support while also offering hope and encouragement. Okay, instead, I understand that you are feeling worried. We'll do our best to address your concern and support you through this stage. Okay. Next, and lastly, you have rejecting. Rejecting or refusing to discuss certain topic with the client. So these responses often makes the client feel that the nurse is rejecting not only their thoughts for communication, but also the client themselves as a person. Okay? So, let's say, for example, I don't want to talk about that. Let's talk about this. Or, I don't want to discuss that. Let's talk about that. Okay. Another thing. Okay, so, if the client would want to dwell or to explore or describe his feelings towards one topic, then by all means, as nurses, we have to let them do so. So that would be the end for our discussion on communication in nursing practice. So remember, communication is a lifelong process in which people need to exchange information, ideas, and feelings, okay, that may affect one person or another. Nurses need to use communication to develop meaningful relationship with their patients and their families, okay? Through this, The use of communication promotes patients' growth and attainment of health-related goals. So as members of the healthcare team, we need to provide information through communication to our patient in an accurate and timely manner so that this can be achieved or this can lead towards improved patient outcomes and of course, patient satisfaction. Okay, so that would be all and see you on our classroom. Thank you.